We hope you enjoyed Thanksgiving. We also know it wasn't easy. The coronavirus pandemic remains a burden and a threat. Families can't gather. Millions are isolated and struggling. And more than 250,000 Americans have died. So our question tonight for this special report is, what's next? Joining us to provide answers and insights are three of the best journalists on this story. They have been covering different aspects of the crisis. Fareed Zakaria, host of Fareed Zakaria GPS on CNN, a Washington Post columnist and author of 10 Lessons for a Post-Pandemic World. Yasmeen Abutaleb, a national health policy reporter for the Washington Post, and Sarah Kliff, an investigative reporter for the New York Times, covering the American healthcare system. Let's begin with Dr. Anthony Fauci, the nation's top epidemiologist, who spoke with me earlier this week. He was upbeat about vaccines, but he warned that winter could be bleak.
Now what we're seeing, almost the entire map of the country is lighting up with the dark colors, which indicate increased test positivity, and the slope is like that, which means that if in fact you're in a situation when you do the things that are increasing the risk, the travel, the congregate setting, not wearing masks, the chances are that you will see a surge superimposed upon a surge.
That made me sit up, a surge superimposed upon a surge. Yasmeen, when you listen to Dr. Fauci and when you talk to health officials, what do you hear? What is keeping them up at night?
I think, the biggest concern is that there really isn't a federal response right now at this time where we're at the worst point in the crisis that we've been. In the spring, you saw this national shutdown, a bit more federal leadership, and the crisis is actually worse now than it was then. There's this huge fear that's been playing out, that a federal response could not wait until President-elect Joe Biden takes over on January 20th. You can't just let the crisis spread unchecked for those 10 weeks. And that's essentially what we're seeing happen. You see states taking different steps, to try to control it, some states being more willing than others to take dramatic steps. But right now, you're not seeing a lot of federal leadership. There isn't a lot of federal messaging about what to do. There's obviously huge concern about Thanksgiving travel and get-togethers and what that's going to mean for a surge or an uptick afterwards when we're already at around 170, 180,000 cases a day, and that these smaller healthcare centers and hospitals are not getting the help and resources they need.
Sarah, you cover healthcare workers and patients. So out in the country, what is their reality right now?
I think there's a lot of really tired healthcare workers who have been fighting this day in and day out across the country. And really the fear right now that I hear expressed by public health officials, by hospital executives, is that what we could see in the next few weeks is something like what happened in New York City in March and April. Just this huge surge, a need for more staff, a need for more ventilators, for more hospital rooms. When it happened in New York, the rest of the country could help. Other states sent ventilators, travel nurses came to New York City, but the real fear that seems to keep these workers and public health officials up at night is that surge is going to come at so many places across the country that there won't be those resources to surge from one place to another. And I think it's certainly true. We've stepped up our production of PPE. There's more masks, and more ventilators too. But the real linchpin is the people. There's only so many people in the U.S. who know how to operate a ventilator, who know how to treat this disease. And that's the thing that keeps, the health workers and hospital executives I talk to quite worried and alarmed, is that they might not have the staff to treat patients when the surge gets much worse in their area.
Fareed, let me read a line from your terrific book. You write, quote, "Nations have created mechanisms and institutions to cooperate and solve common problems. But in the end, in extremis, they walk alone. This is a global crisis, but which challenges are uniquely American?"
It's the paradox of a pandemic that while by definition it's global, it forces countries to become somewhat more isolated. you cut off or you limit travel. You have to put your own house in order. In the American case, I think there are two principal challenges. We're going to go beyond Trump for a moment. One is the crazy quilt patchwork of center, state, and local authority. The United States does not have, one government that is handling the pandemic. It has 9,000 roughly separate units of government that have to coordinate and have similar standards and travel and things like that. And that has proved a huge problem. The second is more cultural. There is within America's DNA a certain kind of anti-statism, the kind of don't tread on me philosophy. And so it becomes hard to get people to observe quarantines, mask wearing. The CDC has advised don't travel during Thanksgiving or don't have large gatherings. It's very hard. That rubs against the culture of the country. Both challenges exist for other countries, but they are in some senses especially American, and it is certainly true that we've been especially bad at dealing with them.
Yasmeen, what is the outlook on vaccines this week? What are they watching for at the FDA?
Well, I think one of the rare signs of positive news in the last couple of weeks has been these three very promising vaccine candidates that have reported their first results. So, at the FDA, there is an advisory committee meeting scheduled to review the data on Pfizer's vaccine on December 10th. I think a lot of people are hoping that an emergency authorization for that vaccine comes shortly after that meeting. And then on the other two candidates that have reported results, Moderna's vaccine and AstraZeneca, it'll be the same process. The FDA reviewing the data to see, if it warrants an emergency authorization, which is not the same as a full approval, which takes much more time, but basically is an assessment that the benefits of the vaccine outweigh any potential risks in the middle of a public health emergency.
But Sarah, is the system you cover ready to effectively distribute vaccines in the coming months?
That makes me think of the question you asked Fareed. And when I think of the American experience with coronavirus, one of the unique challenges we have is this incredibly fragmented healthcare system where we don't have a national healthcare system like many of our peer countries. We have competing health insurance plans and some private plans and some public, and this whole patchwork of providers. And it will be a challenge to get the vaccine out through that system. If you think of all the different places where Americans get their vaccines right now, sometimes at the doctor office, sometimes at a pharmacy, sometimes through their workplace, we're going to have to figure out how to distribute it and distribute it in an equitable way to make sure that the people who really need this vaccine get it first. So that's the next, large hurdle we're going to deal with. And I think it's one that public health officials are quite eager to deal with. They want to get this vaccine out to people. But we have a system that is, not set up to be efficient because there are so many different players. You could have places where the lack of communication makes it a bit more challenging to distribute a vaccine in our country, compared to some of our peers.
Fareed, beyond that efficiency point, will there be enough public confidence in the vaccines to get the nation out of this crisis? You've spoken to Bill Gates in recent days about this topic.
Yeah, look, it's a huge problem, and let me pose what will be a real challenge if it materializes. Right now, Donald Trump is pro-vaccine because he sees it as being something that he spearheaded and he helped fund with the Operation Warp Speed. In a few months, the vaccine is going to be Joe Biden's vaccine, at which point, if Donald Trump becomes an anti-vaxxer, if he says, I started this program well, but the Biden administration has totally screwed it up, don't get vaccinated. Remember, he still has a huge number of people who hang on his every word. That massively complicates the scenario. But let me be somewhat optimistic about this. I think that it's worth pointing out these vaccines have been developed faster than any vaccines that we know of. This is an extraordinary achievement. We're probably going to have 7 or 8 of these. If you think about the first phase of the health crisis was a public health response, which the United States basically botched. The second phase is going to be therapies and vaccines, which is largely a private sector response. I would suspect the United States will overperform or outperform on that metric in terms of production, even in terms of distribution. The key issue is going to be the one you asked, which is public trust. And over there, as I say, the most worrying variable is Donald Trump. And he's not the only guy. As I point out in my book, this whole wave of populist leaders who scorn expertise, who scorn scientific knowledge, they could have a second act with the vaccine, because that will be a place preeminently where you need to trust experts.